and welcome to the California Department of Public Health Childhood Lead Poisoning Prevention Programs Lead Week webinar series. My name is Danielle Ramos, and I am a health education consultant with the Childhood Lead Poisoning Prevention branch. I'm really excited to be here with all of you. Buenas tardes y bienvenidos a la presentación webinar del Departamento de Salud Pública del Estado de California, Programa de Prevención del Envenenamiento de Plomo en los Niños. Mi nombre es Danielle Ramos y estoy muy emocionada de estar aquí con todos ustedes. We're grateful to share this platform with all of you, and we're really excited to be hosting our wonderful presenters who will be sharing information about what lead is, how it impacts children's health, and how to prevent childhood lead poisoning. They'll also be sharing examples of how communities in Los Angeles have gotten involved with local organizations and the LA Health Department to address and prevent childhood lead poisoning. Estamos agradecidos de poder compartir esta plataforma con todos ustedes y nos emocionamos para presentar a nuestros maravillosos exponentes que compartirán información sobre el plomo, cómo el plomo afecta la salud de los niños y cómo prevenir el envenenamiento de plomo en la niñez. También compartirán experiencias vividas en las comunidades de Los Ángeles. Estas comunidades se han involucrado con organizaciones locales o el Departamento de Salud de Los Ángeles para prevenir el envenenamiento de plomo en los niños. In just a few moments, I'll be introducing the presenters and we'll get started, but I first wanted to provide a few logistical details for using the various features for our WebEx event today. To minimize the potential for background noise, all of the participants are muted during the session. However, please feel free to use the chat and the Q&A features, which you can find at the bottom right-hand corner of your screen. If you need the meeting to be translated, you can choose to translate the conversation in real time from English to one of over 100 different languages. At the bottom left-hand corner of your screen, you can find an option to turn on the captions and the highlights, and you can also select from a drop-down menu list of languages. Please let us know in the chat if you need assistance with this feature. Please note that this meeting will be recorded, and you'll be able to access a copy of the recording on our website in mid-November. Dentro de poco, presentaré a los exponentes y comenzaremos, pero primero quiero brindar algunos detalles logísticos para que ustedes puedan usar las diversas funciones de nuestro evento de WebEx el día de hoy. Para minimizar la posibilidad de ruido de fondo, todos los participantes tendrán sus micrófonos apagados durante la sesión de hoy. De todas maneras, no dude en utilizar la función del chat y la función de preguntas-respuestas que puede encontrar en la esquina inferior derecha de la pantalla. Si necesita que esa reunión sea traducida, puede optar por traducir la conversación en tiempo real del inglés a uno de más de 100 idiomas diferentes. En la esquina inferior izquierda de la pantalla puede encontrar una opción para activar los subtítulos y también puede seleccionar una lista de idiomas de un menú desplegable. Háganos saber en el chat si necesita ayuda con esta función. Tenga en cuenta que esta reunión se grabará y usted podrá acceder a una copia de la grabación en nuestro sitio web a mediados de noviembre próximo. All right, I'm just going to see if there is anything in the chat really quickly. Great. All right, so thanks so much for, again, for being here. We're really thankful to have with us today Dr. Jill Johnston and Dr. Elizabeth Kamai, researchers from the University of Southern California. Dr. Johnston is an assistant professor at the University of Southern California in the Division of Environmental Health. Department of Population and Public Health Sciences of the Keck School of Medicine of USC, and the USC Spatial Sciences Institute. She also serves as the Director of Community Engagement in the Division of Environmental Health at the University of Southern California. Dr. Johnston's research focuses on addressing unequal exposures to harmful contaminants that affect the health of working poor in communities of color. She previously worked as a community organizer on issues of environmental and economic justice in South Texas. Dr. Johnston received her PhD in environmental sciences and engineering from the University of North Carolina at Chapel Hill, where she studied hazardous waste sites and industrial animal production. Currently, she engages in collaborations with grassroots organizations to conduct community-engaged, action-oriented research at USC to support environmental justice. Dr. Elizabeth Kamai is a California native, an environmental and reproductive epidemiologist, and a postdoctoral fellow working with Dr. Johnston in the Division of Environmental Health at the Keck School of Medicine at the University of Southern California. She received her MSPH and PhD in epidemiology from the University of North Carolina at Chapel Hill, where she studied childhood blood lead surveillance and the relationship between local point sources of lead and children's blood lead levels. Her research at USC examines sources of environmental contaminants and how they affect the health of pregnant women, children, and other vulnerable communities. All right, please feel free to ask any questions that you might have during the presentation in the Q&A, and we'll be making some time at the end of the presentation for further discussion. Please join me in welcoming our presenters, and I will go ahead and hand it off to Dr. Johnston, who will lead us into the presentation.
Good afternoon, everyone, and thank you so much for the invitation to speak with you all and to share a little bit about some of our work here in California and specifically Los Angeles. So this presentation, we're going to kind of start off with an overview to think about what are the health impacts of lead, why is it a chemical that we really care about and is a big concern, where are some of the current sources, and then talk a little bit about industrial sources of lead and how it may impact communities. And so I'm going to pass it off to Elizabeth to launch the presentation and share some of the background information with you.
Great. So thank you for that introduction, both Danielle and Jill. You can go to the next slide. I'll start with a brief overview of how lead exposure harms our health. Next slide. Lead is a well-known, notorious toxin that can affect virtually all physiologic systems, as you can see on this diagram. Lead can act like calcium in our bodies, and calcium plays a key role in how our brain cells communicate. So lead is a particularly harmful neurotoxicant or brain damaging chemical. Children exposed to lead at very young ages can have poor cognitive abilities and higher risk for attention difficulties or ADHD. And lead exposure in adulthood, for example, at work, can result in nerve damage, tremors, and other neurological disorders. Next slide. Lead exposure in childhood can have lasting health impacts. Adults who are exposed to lead when they were kids can be at higher risk for some of those neurological outcomes like headaches and memory loss, as well as other outcomes like high blood pressure, kidney problems, and joint pain. So it has long-term impacts. Next slide. Lead has no good use in our bodies. Any lead in our bodies is from pollution or contamination, and there is no safe level of lead exposure for either kids or adults. The Centers for Disease Control and Prevention, or CDC, sets a reference level of 5 micrograms of lead per deciliter of blood in children. And kids with blood lead levels above 5 micrograms per deciliter are supposed to receive additional testing and follow-up to remove sources of lead exposure in their environments. But we know that very low levels of lead, even levels below this reference level, can affect children's development, brain development and pregnancy problems like low birth weight. And we also know that there are millions more children in the US that have these very low levels of lead exposure than the very high levels of lead exposure above this reference value of 5 micrograms per deciliter. So even if the effects of lead exposure are smaller, for example, on this chart on the right, on the impact of lead exposure on IQ, that impact is smaller at lower levels of lead exposure for an individual child. On a population level, those low lead exposures have a dramatic impact. Next slide. These low levels of lead exposure can also result in changes in an individual's brain and behavior. Children and teenagers who are exposed to even low levels of lead are more likely to have behavioral disorders and symptoms of conduct disorder or ADHD, and more than 20%, or 1 out of every 5 adolescent ADHD cases in the US can be attributable to lead exposure. There are also ecologic correlations between population or community lead burden and crime trends. And there's some evidence that reducing lead exposure in the 1970s contributed to the drop in violent crime in the 1990s. So lead exposure is not just an individual problem, but can have broader downstream community impacts. Next slide. We can also see these population level impacts with heart disease and stroke. Cardiovascular disease is among the leading causes of death in the US, taking the lives of over 800,000 Americans every year and costing over $300 billion in healthcare costs and loss of productivity. Lead exposure increases heart disease risk in adults. Adults with the highest levels of lead in the US, the 90th percentile, have 70% higher absolute risk of dying from heart attack or stroke than those with the lowest levels of lead. And one estimate shows that lowering blood lead exposure in adults could have a bigger impact on reducing these cardiovascular disease deaths than if all smokers quit smoking, or if physically inactive people took up exercise, as you can see on this graph on the left. So again, lead has both long-term and widespread impacts on our health and communities. Next slide. Preventing lead exposure is key to eliminating its harms for a few reasons. First, the only way to reduce the amount of lead circulating in our blood, except in very extreme cases, is to remove the source or sources of lead in the environment that has caused the lead in our blood. As I said before, lead exposure during childhood can have lasting impacts into adulthood, some of which may be irreversible. Exposure during pregnancy can result in low birth weight and preterm birth, both of which put infants at higher risk of health problems, including infant mortality. And finally, lead exposure is intergenerational. So remember, lead acts like calcium, and after prolonged exposure, most of the lead we're exposed to gets stored in our bones. If a pregnant person was exposed to lead during their childhood, even years previously, that stored lead in their bones will recirculate in their blood during pregnancy and impact both their own health and that of the developing fetus. So again, it is vitally important to prevent lead exposure in the first place. Next slide. The good news is that prevention is possible. So structural changes and federal legislation to remove lead from our homes and environment did successfully lower children's blood lead levels in the US. Starting in the 1970s, when there was growing awareness of the harms of lead in children in particular, laws were enacted to remove lead from gasoline, to ban lead in consumer paint, to remove lead from canned goods, and limit lead levels in drinking water. And you can see on this graph that these laws were accompanied by dramatic declines in children's blood lead levels in the US. Next slide. But lead is incredibly stable in the environment, and lead that has already been released into the environment can stay in soil for centuries. Removing lead from consumer products like paint and gasoline prevented additional worse lead contamination, but there is still lead in the environment from before that legislation. When old leaded pipes deteriorate due to age or chemical imbalances, as in Flint, Michigan, they can leach lead into drinking water. Older homes may have leaded paint from before lead was removed from paint, and this paint can peel and disintegrate into lead dust. And soil near major roadways can contain lead that was released from cars that used leaded gasoline prior to its ban in the late 1980s. Sorry, next slide. Plus, lead is still widely used in other industries in the US, particularly battery recycling and manufacturing. So the US recycles 19% of the world's automotive batteries. Most of these are lead acid batteries, and produces over 1 million tons of lead from recycled batteries every year. At these secondary lead smelters, batteries are cracked, washed, pulverized, and melted into a furnace, and lead is released into the surrounding environment. The impacts of contemporary lead use are concentrated in the communities surrounding these industries, and their soil and air can have dangerously high levels of lead. Next slide. So how can you be exposed or your children be exposed? Like, where can you look for sources of lead, or where could we use additional regulation in our environment? Next slide. There is lead in soil near roads from gasoline used decades ago. Excuse me. I'll also note that while cars no longer use leaded gasoline, there is still lead in aviation gasoline for piston engine airplanes. So the air and soil around many airports contains lead. Homes built before 1978, when lead was banned from paint, may have lead in their paints, which can contribute to lead and dust both indoors and in soil outdoors. Ceramics, toys, and jewelry made in other countries can be contaminated with lead because of less strict manufacturing laws. These items might be decorated with paint or enamel that has lead in it. Enamel is a substance that makes dishes look shiny and smooth and the colors brighter. You can't see lead in enamel or paint, and even if these dishes are not decorated, the glaze can contain lead. Cooking with or eating out of these ceramics can expose you to lead. There's also lead in some imported supplements, some foods, vitamins, spices, and cultural powders that can be contaminated with lead. There is lead in bullets and in fishing weights. Old lead pipes and fittings and service lines can contaminate drinking water. And finally, contemporary industrial activity, such as secondary lead smelting from battery recycling I talked about earlier, and Jill will talk about more later, releases lead into the air, soil, and water nearby these sites. These industries can also be a source of take-home lead, where an adult is exposed at work and unintentionally brings lead dust home with them on their clothes or their shoes or in their car. Next slide. The primary ways lead gets into our bodies are through ingestion, which is eating or drinking or unintentionally consuming lead-contaminated substances, or inhalation, which is breathing in lead-contaminated air. Next slide. There can be many sources of lead in a child's environment, as you can see from this graphic. Very young children who spend most of their time on the floor and who put everything in their mouths can be more highly exposed to lead than adults or even older children in their same household. Cleaning up lead is one way to remove potential lead in your home environment. Cleaning up dust is one way to remove potential lead in your home environment. To clean up the lead dust, you can wet wash windowsills, walls, floors, door frames, etc., with a mix of detergent and water. You should also regularly wash your hands and your kids' hands with soap and water, and make sure to wash toys, bottles, pacifiers, especially if those toys have fallen on the ground where they could potentially pick up dust or contaminate soil. Next slide. Lead exposure does not impact everyone equally. At an individual level, the most vulnerable members of our community to harms from lead are infants, children, pregnant people, and workers in lead industries. These individuals are vulnerable both because of their stage of development, as in the case of infants and pregnant people, but also because of the relatively large amount of lead to which they can be exposed. Like, again, a child on dirty ground can accidentally consume way more lead than their parent does. At a community level, neighborhoods with older homes, which have lead paint, and those near lead industries and small airports are more highly exposed to lead as well. Low income and communities of color disproportionately bear this burden of environmental lead exposure. I will now hand it over to Dr. Johnston, who will talk about more of these communities.
Thank you, Elizabeth. So with all that kind of background and information, as we think about kind of the multiple sources of lead that still remain in our environments and how we may continue to be exposed to it, I want to share, an example of ongoing work happening here in Los Angeles to address some of these legacy sources of lead contamination and how it may be impacting communities even after we shut off some of the sources of lead. And so this was a collaboration between University of Southern California and several community groups led by East Yard Communities for Environmental Justice, which is based in Commerce in Los Angeles County. So next slide. So as Elizabeth mentioned, sort of these lead acid battery smelters are one sort of important sort of point source or single source of air pollution, lead contamination in some communities. And so what happens at these facilities, they often recycle lead, but they bring in the batteries that are in our cars, in our trucks to the facility. They crush them down and then they melt them to recover the lead in these huge facilities called kettles. And that's shown in the middle picture. But a lot of the processes that happen inside these facilities also release pollution and specifically release dust. And oftentimes on that dust, particularly without proper controls, it contains lead. And so that contaminated dust is released from the stacks at those facilities, and it can end up settling down onto surrounding neighborhoods. And so that's one way we get both lead in some of the air we breathe, as well as outside in our yards. And so next slide. And so one example of one of these facilities is called Exide, and it operated in the city of Vernon. For approximately about 100 years, there was some kind of metal operation that was happening here. And it was a lead acid battery recycling facility since the late 1970s. And during that time, it's estimated that about 7 million pounds of lead was released from these facilities and ended up settling in the communities nearby. They would process about 120,000 tons of lead every year, which comes out to about 11 million batteries. And so this facility, while it was located in a very industrial area in sort of the east part of Los Angeles, it was surrounded by multiple highly densely populated residential communities. And so this is East Los Angeles, Boyle Heights, Maywood, Commerce. And so these communities sort of faced the impacts of these operations on exposure to lead. So next slide. And I think one thing that's really important to point out is that the communities that live there, live near Exide in this battery facility, were the ones that really recognized the potential harmful impact it was having on communities and on health. And so the community started organizing back in the 1990s to identify need for like remediation and cleanup because of the operations of Exide. And they were the initial voices that really demanded the communities come out and start to do soil cleanup, soil testing, and understand what was happening. And so it turned out this facility was releasing higher than allowed amounts of lead into the air. They couldn't meet the Clean Air Act standards. And eventually the Department of Justice at the federal level stepped in 2015 and shut down the facility. And so with that, one of the benefits is that it stopped the sources of lead to the community. And so they had to stop operations. And also sort of the owners ended up pleading guilty to a variety of felonies around how they transported hazardous waste because lead is such a hazardous material. But one of the lingering questions, even though this facility got shut down, is trying to understand what the potential long-term impacts are for the community that has been living near this facility for nearly a century, because we know lead just doesn't disappear or goes away, but it stays in the environment. So next slide, please. And so with that, and with sort of organizing work from the community, what started out as some initial sampling of a few homes has ended up into sampling of over 8,000 residential properties in this area in Southeast Los Angeles. So what was found through this massive effort of testing is that 97% of the homes were higher than the current state of California health-based threshold for soil lead contamination. So that means that we have widespread exposure to lead across this community. Next slide, please. But one of the lingering questions was, even though the source of this lead got turned off, what was the potential sort of long-term harm? And as Elizabeth had mentioned, lead can really mimic calcium and some of these other nutrients in our bodies. And so what actually it can do is be integrated into bones. And one of those is teeth. And so how baby teeth form as fetuses develop is very similar to how we think about tree rings, right? And so every week during pregnancy, there are these layers added to baby teeth as they grow. And so we can understand potential toxic metals that were in both the mom's body as well as in the baby's body by looking at baby teeth. And so the community really wanted to understand what historical levels of lead may look like. And so we were able to develop a project that used baby teeth, which often people keep from their kids, as sort of these preserved markers to understand what lead levels look like in kids that grew up in this neighborhood while this facility was operating. So next slide. So essentially what we found through this research and collaboration with the community is we saw a significant association between the levels of lead in the soil and the levels of lead in the teeth, both during pregnancy as well as during childhood. So kids that lived and then grew up in areas that had higher levels of soil contamination, we were also able to observe that same patterns in their teeth. And why this can be really important is it can help demonstrate that contamination of the soil is an important exposure pathway for lead contamination in kids, in addition to paint and consumer products and some of these other sources that we talked about. And, you know, it also gives us an idea for interventions because it demonstrates that if we have lower amounts of lead in the soil, we should also see that sort of reduction in lead exposure in kids, as well as the importance of preventing the exposure because this started during pregnancy. And so being able to protect people in the community, including, you know, adolescents and adults from lead exposure has the benefit of also preventing these kinds of exposures to future generations. So next slide, please. And although lead in teeth isn't used as a very common metric, right? If you want to go and understand lead exposure, sort of the standard is to use blood. We're able to use teeth to get a picture of what's been happening over time and in the past. And we're also able to compare the levels we saw in this community in East Los Angeles compared to another urban area in Boston that also used teeth to try to understand more about lead exposure. And what we saw was that levels in the teeth in the kids that grew up near this smelter were about twice as high as this other urban community. And, we consistently saw this pattern that as levels in the soil increase, we have more lead in the teeth. And we know that lead in the teeth is also indicative of the lead that can enter your brain, enter your blood, damage your kidneys. So it can really be a marker of potential adverse health consequences. Next slide. So as we are able to kind of document and demonstrate some of these pathways of exposure, as well as how it can have these intergenerational effects, I mean, really the key take-home message is that preventing these exposures in the first place is really key in order to try to protect people's health, as well as address a lot of the racial disparities we see in terms of lead exposure. So lead, unlike a lot of contaminants or chemicals we think about, has actually been regulated for a long time. And there are many different agencies that have some aspect of trying to reduce the amount of lead in the environment. But that landscape can also make it somewhat complicated because some of these agencies sort of operate in silos. And so when we think about the different places where people are regulating lead, it's from the air quality side. So all the soil contamination is dealt with through hazardous waste agencies. There are agencies that deal with childhood lead testing. We also see others that deal with occupational exposure, so workers that are potentially exposed on the job. And then there's multiple sort of municipal level governments that are also involved in thinking through or addressing sort of lead exposures in different ways. And so this landscape can also make it somewhat complicated for communities to navigate and understand who can help address and reduce exposures in their environment or in their household. So next slide. And while we've been talking about lead for decades in this country and have understood the negative health impacts that it can have, we continue to see really adverse impacts of lead exposure. And so one study found that in California alone, the economic toll from lead exposure is estimated to result in a loss of learning of $8 to $11 billion a year over the lifetime of children. So this helps put into context some of the really important need there is for preventing lead exposure, for making sure that children are tested, and that we try to eliminate a lot of the sources, because when we look over a population, right, even low levels of lead exposure can have really real consequences, both in terms of health as well as in some of these economic metrics. And so thinking about, potential important ways in order to do that is one, thinking about proactive surveillance. Many kids, but not all kids, are tested for lead at their doctor's office. But that's really an important touch point to see and understand what exposure to lead is looking like across sort of a wide swath of population here in California. And so the systematic collection of that kind of data and trying to understand some of the spatial patterns, right? Some of these where we see clusters of people exposed to higher levels of lead could really help identify some of these lead sources in communities that may be going unnoticed, like the Exide issue, for example. And so really using data that we have can be really key to help inform and target prevention strategies. Also workplace exposure is another important place where we see high levels of lead exposure that can also be brought back into the homes. And these workers are oftentimes tested for lead. And so looking at that information and seeing workers and industries that are exposing people to lead is another sort of indicator we can use to try to identify some of these interventions. So for example, in the Exide community, many of the workers were tested regularly, the ones that worked inside the smelters. And so they had very high levels of lead in their blood. And so that could be an indication that there's operations going on that can really be changed in order to better protect people's health. And so the identification and elimination of these environmental sources of lead is really important, so we can try to do primary prevention of exposure. So next slide. And I think really a key message is that lead exposure is something that's preventable. There are efforts and work that can be done to really try to eliminate this as a source of contamination in children. So for example, through inspections and doing lead abatement in homes, especially in homes that have peeling paint or other conditions that make them sort of more vulnerable to the children that live inside, through replacement of lead service lines, so the water lines, removing lead from sources that we currently see them, such as in aviation gas, so in that plane, the small plane gas, wheel weights, bullets, and really using some best available control technologies for industries that continue to use lead or to recycle lead can really help reduce some of the impact it may have for people living nearby. And so I think that's last slide. So just want to, thank all the partners on this project and some of the different centers based at USC that's helped inform some of the work and sort of guide information for thinking through how we can address lead exposure here in the state of California. So thank you, everyone. I think you're muted, Danielle.
Okay, thank you so much. I was just saying, thank you so much for just a fantastic presentation. We're really, really grateful to have heard from you and learn from your expertise and just learn from, all of the wonderful work that's really going on in the Los Angeles area. And again, just thank you so much. So now we are going to be opening it up for questions. So let's see. I see a question from Christine. I work with children ages 0 to 3 with deafness and hearing loss and their families. During my experience over the past 20+ years, I have seen a significant increase in children with unilateral hearing loss. Do you know if there have been any studies that link lead exposure in mothers to diagnose hearing loss or deafness in their babies?
Thank you for that question. I have not specifically worked with hearing loss, but I know there are studies that show that exposure to lead can result in some hearing loss and hearing impairment in children. And so that's definitely one of the known health impacts. And I know there's been some interest in understanding that more. I don't know, Elizabeth, if you've worked more on this.
I haven't. I know there's more literature and research with workers occupationally exposed to lead and hearing loss as they get older. But I imagine those same pathways of exposure and outcome exist at very young ages.
All right. And thank you, Maureen, for your comment. It's a really great idea to have a database for results, just as we do with immunizations on blood levels being drawn at 12 and 24 months. And there are questions as to whether or not the slides will be available. Yes, we will be posting the slide deck along with a recorded version of the presentation on our website within the next few weeks. So on the same link that you used to register for this presentation, you can find access to those.
I think to respond to Marine's comment, thank you for sharing that. And I think we've seen a systematic pattern with some studies that look across the state of California with children on Medi-Cal not always receiving blood lead tests. And then children not on Medi-Cal are not required to have a blood lead test. And so that can, we can potentially be missing a lot of information about what's going on. And I think thinking through ways to really support or encourage blood lead testing for children as well as potentially for pregnant women and workers is something kind of really important as we think through efforts to try to identify, where some of these hotspots are happening, as well as reduce these exposures. I think lead testing is supposed to be mandatory for children on Medi-Cal.
Yes, providers should be testing kids who are in public programs at 12 and 24 months.
To that comment, Maureen, about a blood drop test versus a venous test, I think that's super important. There currently is only one device available and registered in the U.S. to measure blood in just a capillary drop, like a finger prick, and it's okay, but it's not great. Its limit of detection is around 3 micrograms per deciliter, so it can tell you if your child has above the CDC reference level, but it doesn't provide a lot of information. And it's been recalled on and off a few times over the past decade. So it's not as reliable as a venous test, like blood test that you can send off to a lab.
And just to answer your question, yes, healthcare providers who perform periodic health assessments for children are required to inform parents and guardians about the risks and effects of lead exposure, and the requirement that children in Medi-Cal should be blood lead tested, and the requirement that children not in Medi-Cal who are at high risk of lead exposure should also be blood lead tested. And I provided a little bit of guidance there in the chat for you.
I mean, I think it's also really important, as mentioned, to make it more accessible to be able to get these blood lead tests, because I know sometimes, like for example, in the Exide community, sort of in response to this, this disaster, the county health department has set up free blood lead testing for anyone who lives there. So people can go in and get a test, but that's not typically available to most people in the community, in the broader community or in the broader state, who may be concerned about that. And there may be a lot of barriers, right, to accessing a physician in order to get blood lead tested. So thinking about how we can make it more accessible to people, and also make sure that we can make the results understandable. Because oftentimes you ask people, like, oh, they know they got tested, and you say, what were results? Oh, they said I was fine. It's hard to know what those numbers what the numbers mean, and oftentimes like the parents won't know or don't remember sort of what the levels were. And so I think in general we can do a better job about giving that information back to people and be able to contextualize it and have resources for understanding sources of exposure, especially in places that live with some of these legacy lead contamination sources.
Thank you so much for bringing up, access. I know it's something that, our department is working on, kind of collaborating with and learning from communities about how to improve access to testing. And we'd love to, work with different groups that really have the experience and understanding of how to do that. So thanks for bringing that up. That is definitely something on our radar. There's another question from Kayla. Children are being under-tested for lead. How can families or community members address this? How do we hold health departments accountable for lack of efficient testing? How do we demand for an increase of testing for blood tests?
I know there are other states that, there's universal mandates, right, for all children to get tested. So that's, one first step that can be done. I mean, I think also making sure there's resources to, address or do the education and the prevention that's needed if children test high for lead. And that's thinking the CDC reference value is this 5 micrograms per deciliter. But we know kind of any level of lead could have adverse impacts. And so I think both having, the accessible testing as well as making sure there are the resources available to sort of help families and think about kind of especially these legacy sources and environmental sources of lead and how we can reduce those. It's really critical to, I think, work both in tandem.
And some of that also is a health policy question. I'm not entirely sure in California. I believe that like Medi-Cal, because it's required, lead tests are reimbursed by Medi-Cal, but they might not be reimbursed or fully reimbursed or as easily paid for on other kinds of insurance. And so changing those kinds of laws has to be done at like a state or federal level and requires action and input and work from policymakers.
Maybe I'll just add one thing we've been thinking about with the community around Exide. So they've been able to secure, funding to do at least the initial cleanup of a lot of the soil, of the contaminated soil in the area. So that's going to help, continue to remove the sources of lead from the community, which is really important. But we know there's these long-term impacts of lead. So thinking through how we can work across agencies, institutions to think about sort of these long-term sort of community resilience is really needed, from examples like reading programs, job training programs for youth, thinking about like what was brought up with the hearing, like hearing tests for kids or adults. And I'm not totally sure what it looks like, but encourage people as we're talking about lead to really think about what are some of those long-term strategies to try to address in these communities that we know have been disproportionately impacted by lead. since you know, the impacts have already happened on the body, right? And so what other resources are really needed to move forward and to be healthy? And I think those are some other like key conversations that really is going to require sort of interagency effort to make that happen.
Yeah, you definitely touched on a lot of really key points there. It doesn't only affect the child when they, you know, they have that high blood level, but definitely throughout their lifetime. Thank you for that. Alrighty. All right, are there any other specific questions for Dr. Johnston or Dr. Kamai?
Yeah, thank you for the invitation and the opportunity. I'm excited to see all the work happening on sort of lead poisoning prevention, and definitely happy to connect and continue some of these conversations and learn from people working in this field as well.
Yeah, thank you so much for.
We're so grateful. Yeah. Go ahead, Dr. Kamai.
Oh, just wanted to thank you and echo what Jill said. Happy to continue to share research and be a resource to you all and those on the call.
Wonderful. We're just so lucky to have you here during our you know, celebration of Lead Week, and so grateful for the wonderful presentation. I did put a link in the chat. If you all have a chance to provide some feedback on this presentation, we'd really appreciate it. Let me add it again. It's there in the chat for you all. So I appreciate all of your time, and thanks again to everyone. And I hope you have a great rest of your day. We do have 2 more sessions this week for our Lead Week webinar series, one that focuses on child care providers tomorrow, and then also environmental professionals on Friday. We look forward to hosting you all then. Thank you so much and have a good rest of your afternoon.
Thank you.
Okay, bye-bye.